Hi, I'm Dr. Draeger with a message for my patients and for anyone else who's interested about COVID-19 pneumonia and your choice of accepting or declining a ventilator. I have an internal medicine private practice in Folsom, California for over 33 years now. I'm also the chairman of the ethics committee and the medical director for the palliative care service at our hospital. And I'm board certified in both internal medicine and hospice and palliative medicine. Most people who get infected with this coronavirus either never know they have it or they just get over it at home. Of those who get so sick that they need hospitalization, most of them can get by with just getting a lot of extra oxygen to breathe, along with all the other medications and treatments that a hospital can give. However, some people get so sick they need to be sedated, have a tube placed into their windpipe, and be placed on a ventilator breathing machine in order to try and give the body enough oxygen. Unlike other severe pneumonias that require a ventilator, where after a few days people usually get well enough to get off the ventilator, with this COVID pneumonia, people are often on ventilators for 1, 2, or even 3 or more weeks. And even then, over 70% of these ventilated patients do not survive. And the mortality rate is even higher if they have diabetes or hypertension or obese, and higher if they're older, especially if they have other underlying diseases. Over time, multiple organs just begin to fail. If they do survive, they're not going right home. The body has become so worn out, it'll take quite some time for them to get back to being able to do what they could do before they got sick with this virus. And many, I'm afraid, will never even get close to making a full recovery. As a doctor, these low chances for surviving ventilator treatment are more than disturbing. They make my heart sink. So, when you compare the burdens with the benefits of being on a ventilator, you have some choices. You may want a ventilator treatment despite these numbers. Or you may not want to be kept on a ventilator for more than a few days if you're not improving. Or you may not want to be put on a ventilator in the first place and just be kept comfortable, letting nature take its course, whatever that might be. These choices are yours, and they are all morally and ethically acceptable. They are acceptable in all major churches. And declining or stopping any treatment is your right according to the Supreme Court. This is something you need to discuss with the person that you have chosen to make decisions for you if you become unable to speak. Please, let the person you've designated, hopefully in an advanced healthcare directive, know what your wishes are. And your doctor can help you and give you more information and guidance for your individual situation during these times. Also, if you have, or if you are making decisions for a loved one who has a severe end-stage disease like dementia or cancer or heart, lung, liver, or kidney end-stage diseases, CPR offers a very low likelihood of surviving an event that causes the heart and breathing to stop. You need to talk with your doctor, who knows you personally, about a physician order for life-sustaining treatment or a POLST form. I'm not saying all of this to scare you. It is my deep hope that with this information and with knowing that you have the ability to make choices, that things will become less and less scary for you during this current pandemic. I urge you to love life, find all the joy you can, and seek and accept God's inner peace.